Welcome back to Hardball. In 2017, Republicans weren't able to agree on a replacement for Obamacare. And now Democrats are trying to figure out their health care plan, with Medicare for All becoming the latest progressive buzzword. A recent Kaiser poll shows that a majority of Americans, 56%, and 81% of Democrats support a national health care plan. But the field of potential 2020 Democratic candidates have a very different sense of what that plan would look like. They range from entirely replacing private insurance companies with a government plan to giving all Americans the option to buy into Medicare, to lowering the age that Medicare kicks in naturally. Let's watch.
How do we get universal coverage? Medicare for all. Lots of paths for how to do that.
Listen, the idea is that everyone gets access to medical care. And you don't have to go through the process of going through an insurance company. Let's eliminate all of that. Let's move on.
Even countries that have vast access to publicly offered health care still have private health care.
People will say Medicare for all, and nothing will change. And I think if we can make that change of Medicare at 55 or Medicare at 50, it will make all the difference in the world for millions of people, and then we get to the next step.
When we said that health care is a right, not a privilege, and that we should create a Medicare for all single-payer system, I was told I'm crazy, it's extreme, I'm a fringe guy.
I'm joined now by Dr. Ezekiel Emanuel, the chair of medical ethics and health policy at the University of Pennsylvania. Zeke, thank you for joining us, Doctor. And I guess you'd have to explain, what does Medicare for all actually mean, as you hear it?
Well, I think as Elizabeth Warren said there are a variety of different views on it. At one, there's the Bernie Sanders view, which is get rid of all the insurance companies and have everyone do traditional Medicare. At the other extreme, it could be, well, if you want to buy into Medicare, if you don't have an insurance policy or there's not an affordable one out there for you, then you can get into Medicare. And then in between, there's a variety of other possibilities, but one of them is the Medicare Advantage arrangement would be open to everyone, and among the options there are not just private insurance plans that you could select, but traditional Medicare. So there's a spectrum of what it might mean, and a lot of people are not defining too carefully at the moment their views, although Senator Harris and Senator Sanders have been pretty clear about their view.
Well, this is really about financing of health care, not so much health care, but financing of it. And I was just thinking that, you know, the systems that I've been involved in, from the time you're 15 years old as a stock boy in a drugstore, you're paying into it till you're 65. And then if you live 10 years more, you get, which is about average 10 to 11 years for a male, you get 10 or 11 years of coverage for all those 50 years you paid in. If you're a woman, you may be fortunate to get 15 years. That's your life expectancy. But to go from that to a system where you're covered for health for your whole life, how could you possibly pay into it during your lifetime, your working life, to offset the costs of your health care from day one when you're born? How would it work?
Let's distinguish two things, Chris. One is, what's the total cost of health care? And actually, most of the analyses show that if you do Medicare for all, the total cost of health care doesn't change, doesn't increase. It actually might decrease a little bit. So the issue is, where's the money coming from? Now, yes, as a stock boy or as a professor at the University of Pennsylvania, I get my insurance. My employer sponsors it, but it basically is coming out of my salary in a hidden way as a fringe benefit. So if you went to Medicare for all, that money that's really coming out of my salary would have to be transferred to the government, and then the government would dole it out, as you point out, either to doctors and hospitals through traditional Medicare or to insurance companies and doctors and hospitals through Medicare Part C. I think it's important to distinguish. One is how the money changes, but the fact is it's not going to be more money. It's just going to be, which ledger is it on? Is it on the tax ledger or is it on the employment fringe benefit ledger?
Can we afford Medicare for all from birth to death? Can we? The way our government works.
Well, as I just said here, Chris, the actual total price, when the experts look at it, is not going to be much different than what we're paying now. It's a matter of which pot it comes from, not that the pot is going to grow. So Medicare for all is not actually growing how much we're spending on health care. Okay. Your audience needs to remember, each year we spend $3.5 trillion. That makes the American healthcare system the 5th largest economy in the world. We in the United States spend more money on healthcare than the British economy, than the entire French economy, and we're just below the German economy. So we're spending a lot of money. The issue on Medicare for All is where does it come from rather than are we going to grow it?
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.